Dr. Craig Burns with Maximized Health Chiropractic. What we're talking about in this video is what we call the 30-day traction challenge. Once a year, at least once a year, we, in my household, our staff, and we invite as many patients and friends and family to join us as possible, is to do what we know we don't necessarily have, or what we say we don't necessarily have the time for, which is traction. Most people don't understand traction the way I understand traction, and here's my attempt at trying to help fix that problem. I look at traction, at least regarding the 30-day traction challenge, as like a deep cleaning to the body. It's inevitable that as we all age, there's going to get tension packed into muscles and joints. And most of the time it's going to happen without you feeling it. So you've got to be proactive when it comes to keeping that tension and stress at a minimum. And here's why. Almost everybody you know, including yourself, unless you do what I show you, you're going to have arthritis in your spine as you get older. Now, yes, we all age. Aging poorly is preventable, although aging may be inevitable. Again, aging poorly is preventable if you know what you're doing. So there's going to be tension and stress that sits in your neck, very much like bacteria will often set into a tooth. Okay, we know what happens with that situation. So if it could happen to our neck, a very vulnerable area with a lot of things happening here, a lot of nerves running through those bones, etc. If you want to stay off the surgeon's table and stay off the pain meds, this is something you got to do like I do. Again, once a year, if not twice a year, we do what we call a deep cleaning. We get back onto traction. You know that tool or a different type of tool we gave you to lay down and stretch that neck out for several minutes at a time? Well, at least once a year, we do it for 30 days straight, or as often, as many times as we can do it over the course of that 30 days. Now, maybe for you that might sound like a lot, so maybe you should just start with 2 weeks. But a mental challenge, a start and a finish date, and an all-out effort to do something that you know is profound and helpful for you. So that's how we do it, that's why we do it. Now there's different ways to use traction, there's different types of traction devices, and I can't cover it all in this video. So down below this video I put a little form. If you have questions, concerns, ask us when you're in the clinic. If you haven't been in the clinic in a while, give us a call, stop by. I can help you figure out what you're doing and explain further why you're doing it. Now when we do traction challenge, sometimes we only do about a 5 to 10 minute range. You want to start off simple with traction, just get your feet wet and then see how your body responds, and the next day do it again and again and again. You want to be super stubborn with something like this. After the first week or two, you're going to know that this is definitely a good idea. Why? Because you're probably going to feel looser than you have for the last several weeks or last several months or perhaps the last couple years. So again, I want to encourage you to do this. That's a brief overview of how you do it, and that's a pretty good explanation of why you should be doing it. Again, remember, a lot of this stuff that happens to us, our friends and our family regarding health and disease matters, it's a progression just like a bad tooth. Usually it's happening without us being the wiser. We don't feel anything. So regardless of how you feel, this is just something that good, healthy, wise people do on a regular basis to stay that way. Understand? If you have any questions, if you need any help, if you're not currently an active patient, you've been out of the clinic for a while, give us a call. Another disclaimer, word of caution. Do not do traction without being under the supervision of a chiropractor. And here's a brief, very brief explanation why. Look at your spine as like a kinetic chain, all these little joints and segments moving like a bicycle chain. You don't want to be doing traction when there's a certain joint or certain sections of joint that are just stuck. You're going to go into traction. Traction is going to be harder than it should be. You're going to make the areas that are moving move better, but you're not going to get the areas that aren't moving with traction. Not the way you should be. So I've had a lot of calls of people who've moved to different states saying, I want to continue traction, how should I do it? My first piece of advice is go consult with your chiropractor. Stay under supervision, whether that's only even one adjustment a month, once every 2 weeks. Use chiropractic to your advantage to keep the links of the chain moving. Use your traction to keep everything else around your spine loose, tension, stress-free. You'll be amazed at how well you can feel and how long you can feel that way. There it is, 30-day traction challenge. We're starting this Monday. We usually go for 30 days. The first of the month is always a good day to do it. If 30 days seems too long, try 2 weeks. But I encourage you to do as much traction as you can for the next 30 days. And again, down below, if you have any questions, email us. If you're going to do it, email us and let us know you're going to do it so we can encourage you. Anyways, I hope you enjoyed the video. I hope that makes sense on what you should be doing and how you should be using this tool for the rest of your life. Traction is not just a sometime thing. It's for the rest of your life kind of thing. So is chiropractic care.